Hello, my name is Leah Giordano, and today I'll be presenting you the control process that Henry Ford Health System uses. To give you a little bit of background, I worked for Henry Ford Health System in outpatient rehab as a physical therapist assistant for 2.5 years. I was always impressed with their patient and employee engagement. We would have monthly meetings where the rehab director and supervisor would present some of the information I'll be presenting to you today. To get a really good idea of Henry Ford Health System, I'm going to directly quote their mission, vision, and values from their website. According to Henry Ford Health System, mission: we improve people's lives through excellence in the science and art of healthcare and healing. Vision: we will be the trusted partner in health, leading the nation in superior care and value, one person at a time. Values: compassion: we provide a heartfelt experience to every patient, member, and each other. Innovation: we continuously pursue what's possible through research, education, clinical, and operational excellence. Respect: we honor the commitment to our communities by acting with integrity, courage, and inclusion. Results: we reliably deliver on our promise to be leaders in safety and affordability, ensuring the health of our communities. I do have to say, I felt very respected as an employee at Henry Ford Health System. So, what are their ethical, moral, established standards? So again, I'm going to refer to Henry Ford's website to give you a list of their quality and dashboard metrics and how they can measure the performance that represents their mission, vision, and values. So, according to Henry Ford Health System, the quality and dashboard reflects important measures for the 6 dimensions of quality and safety that have been described by the Institute of Medicine. These 6 things are safe, timely, effective, efficient, equitable, and patient-centered. These are Henry Ford's established standards. More specifically under safe, according to Henry Ford Health System, care will be safe with the goal of eliminating all harm. Timely, care will be accessible and timely. Effective, care will be evidence-based following national guidelines. Efficient, we will provide value through reducing unnecessary waste, being efficient, and reducing costs. Equitable, care is provided to all with no bias. Patient-centered, involving individuals and their families in their care so that it is valuable and meaningful to the individual patients. Step 2 in the control process is how do we measure all of these things? Henry Ford Health System would have monthly meetings to present some of the performance measurements. Some of the performance measurements they would use would be to gather some information on employee satisfaction, patient satisfaction, cleanliness, and productivity. They would do all of this by using a company called Gallup, and I'm going to quote Gallup's website for you. Gallup, according to their website, we are a global analytics and advice firm that helps leaders and organizations solve their most pressing problems. When I worked at Henry Ford, I was a little overwhelmed by how many surveys were presented to us and the patients on a regular basis. They would take all of this information from employees and patients and present it to us in charts, which then the director and the supervisor would present it to us, the employees. So they would take all of this data to measure all of their standards. In step 3, they compare performance to standards. So again, the tactical manager, which would be the direct supervisor, would be taking the productivity from the numbers of that past month and making charts through the use of Excel to present to us what our productivity was, what the hospital productivity was, what other rehab facilities were inside Henry Ford Health System, but also across the country. We would also look at the Gallup patient satisfaction survey to see which areas we needed to improve on. They were very data focused, and very willing to give the employees all the information they needed to make sure that they understood why this was being presented to us in the first place. And step 4 is they would take correctional action if necessary. So we would have regular performance evaluations. So we would have 2 a year individually, and then monthly meetings, which they would represent the productivity and measurements from that past month from the surveys. And through those performances, we would talk about our individual productivity. And with those numbers that were presented to us, the Gallup survey again for employee and patient satisfaction, but then our individual productivity numbers on how many patients we saw that month, and then for 6 months where it's presented to us. If that productivity was not met, the supervisor, so the operational manager, would give us realistic goals and resources to meet those goals. And again, in the meetings monthly, the tactical manager would give us explanations on why those goals were necessary as a company and how we could ethically improve on that. So I believe that all areas of control were presented here. Physical control. They would talk about the budget and what things we needed in that specific department to improve on equipment or building updates. Human resource was another area of control that was presented to us on a regular basis through the performance reviews and job satisfaction. They would also utilize informational. A lot of information based on data was presented to us, not only for satisfaction of the employee and the patient, but also cleanliness standards as well. In addition to the production charts that were presented to us to show us clearly what areas we needed to improve on and how we could improve on them. Financial. So based on all of this data, how much then do we have to do to meet these standards that were given by the strategic or top managers, or something else, how much money is left for something like equipment. So the financial area of control was also presented to us as the employees under the operational managers. Structural. It was very much a bureaucratic organizational control. There were specific employee job descriptions and performance appraisals, but they were, quote, very transparent in delivering all of that to us to make these changes for a business. So it was very much planned out and guided based on past performance of years, also in comparison to other healthcare systems across the country. And cultural area of control was also presented here. And that goes back to their original mission, vision, and value of incorporating and respecting all of the patients and employees as individuals to make the big difference of maintaining their high standards of healthcare. Again, I was very impressed by Henry Ford, and I always felt like they were presenting us information for a reason, and all of the surveys were necessary. And I have a deeper appreciation of all of that information as I was able to really put it in perspective today. And I know that they will continue to be a thriving business because of their high levels of patient satisfaction and care. Thank you.